shows, and he don't even care for clothes. He cares for me. My baby don't care for cars and races. Baby don't care for. He don't care for high-tone places. Liz Taylor is not his style, and even Liberace smile. Something he can't see is something he can't see. I wonder what's wrong with baby. My baby just cares for. My baby just cares for. My baby just cares for me.
Good evening. Welcome to Swingin' with Stu. We've just been listening to Nina Simone's My Baby Just Cares for Me from her Best Of album. Tonight, I'm dedicating this show to my soulmate and wife of some 36 years, Linda. We just celebrated our anniversary yesterday, and I'm so happy to have shared this life with her over all these years. So today, we're going to hear some more music that talks about that kind of love. Here we go.
Ain't got no home, no shoes, no money, no class.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen of the listening audience. I'm Maurice Selby.
This is Sean Shivers.
And you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem.
The voice of Harlem.
And tonight, ladies and gentlemen, we have with us from Harlem Hospital Center, Miss Ebony Carrington.
My boss.
Yes, and Mr. Kevin Shaw from Harlem Hospital Center, and we are talking about emergency preparedness, ladies and gentlemen. Very important conversation tonight, especially in light of a lot of the things that's been happening throughout the world.
Correct.
We don't want to be caught off guard. So welcome to the show.
Thank you.
Thank you. And just, we think about this on a daily basis, at least in my profession, right? Emergency medicine, we're always ready for the next emergent situation, disaster plans. We actually have our disaster drill at Kings County Hospital Center and SUNY Downstate Medical Center coming up. So this is something we think about on a daily basis. But I think in the average home, right, we live in a very safe and secure society. We got 8,000, I think it was, new police men and women that were hired to safeguard the city. So we have a lot of security here, but things can go awry at any given moment. We have to be ready, correct?
Absolutely.
All right. So what can we do in that sense? And just to get right into the conversation, why do we need to be ready for an emergency? Actually, what is an emergency in general? What can we consider to be an emergency, and how can we prepare for it?
Well, the technical definition of an emergency is anything that poses an immediate risk to health, life, property, or environment. So it's just the unexpected. It could be anything from a natural disaster, a fire, an earthquake. We've been victim to several superstorms, all the way down to bioterrorist acts or active shooting incidents, which I think is very material to what's been happening in this day and age. And so having a plan, being informed, and exercising preparedness efforts throughout is of utmost importance. So we'll talk about these things kind of ad nauseum, but the key strategies to emergency preparedness are being informed, making a plan, building a kit, which we'll talk about a little bit later, and just getting involved. So, if you get ready, then you're always ready. So let's just stay that way as a community.
Excellent, excellent. So, Ebony and Mr. Shao.
Call me Kevin.
Kevin. So let the community know. Let the community know as far as what has a hospital. Well, what does the hospital have in place to make sure that we're safe?
Oh, so many things. Kevin, my partner in crime here, is actually the director of our emergency preparedness department. So hospitals, and specifically Harlem Hospital, thinks it's so important to prioritize emergency management and the safety during disasters that we have a whole department dedicated to it.
That's what's up.
So Kevin's the director, and what he does is put us through sometimes rigorous activities of preparedness.
Very rigorous.
We do drills. We have meetings with the community so that we know who to call in the terms of disaster. You are actually one of our partners that if we lose communication, we come through, WHCR. That's right, and WEBT.
Yeah,
So,
that's what's up.
So what we do is we have supplies, we have equipment. In the event that we need to move patients, we have certain apparatus. One of them is called like a medi-sled, and so it means that we can take patients who might not be able to walk or ambulate and get them from one side of the hospital to the other, which is called a horizontal evacuation, or bring them from floor to floor, which is vertical. So we need to make sure we keep our patients safe, and Kevin helps us to practice that. So everything from exercises to supplies and just priority is what we do as a facility.
That's what's up. And when did all of this start to come into effect, really? Because, when I think of emergency preparedness, right, and we look in the past, I grew up primarily, I'm a 90s or 80s. I consider myself an 80s baby, but 80s and 90s baby, right? So, a lot of the stuff, especially during the 90s, as far as home threats or home disasters, that other than seeing things happening, earthquakes and stuff in California, other parts of the country, that really wasn't my reality growing up. But now, things have changed, and we're very aware, actually maybe to a certain extent hyper aware in a good way of things that can happen. But when did all this sort of change, and we started to think in this light of the average American and family being ready for some sort of urgent situation?
Well, Kevin is the historian on this one, and he tells me that emergency preparedness goes back deep into the late 60s and early 70s. But to answer your question, I think that it came to the forefront right after 9/11. So when we saw that the threat of terror was very real, specifically to us as New Yorkers, when we saw that someone could make a plan and be able to execute a weapon of mass destruction and have that impact our lives so significantly, and really we didn't have a plan to recover from that, we didn't know the safeguards, that's when the Homeland Security effort really became very robust, and we had to start to make plans as a nation. And that's actually when NIMS, or the National Incident Management System, was really created and effectuated. So what we do is we have a hospital command structure. We have to show it to all of our regulatory agencies. Sean, you know this. Whenever we're surveyed, they ask us, how prepared are we? We have what's called an emergency operations plan, which we can pull out, and everyone has to know how to respond to different types of disasters. I think what's important about what we do at the hospital and what people can actually take home with them is that they need to gauge their hazards. They need to know what their hazard vulnerability is. So in a hospital, we have to be ready for fire. We have to be ready to keep people there for 4 days, and we have to be able to feed them, and we have to be able to have fresh water supply. So think about what those things are at home. If you live in Esplanade, if you live on the 17th floor of Lenox Terrace, you might not be able to walk downstairs as an elderly person. So who are the people you're going to know on your floor? How are you going to take your pets? What kind of medications are you going to take with you? So while we do this on a large scale in the hospital, people have to be very aware of how to get prepared in the community as well, and in the churches, based on the real travesty, and catastrophe that happened in Charleston.
Kevin, I'm just curious to know from your experience in emergency preparedness, do you believe that individuals in our community is prepared in case there is an emergency, just from your experience?
Actually, we can share some of the data that the survey, at a national level, actually shows that, unfortunately, a lot of people are not necessarily as prepared as they should be. they can do much better job in terms of preparing themselves, their families for the emergency situation. Just for example, just like Ebony just said, we need to have adequate water supplies as well as food supplies. That's the basic when you prepare for the emergency. Normally, we would recommend at least 1 week to 2. In some situations, they also recommend that you should have a monthly supply. For example, in a pandemic flu situation, which you should really avoid to go outside or get exposed from those virus. So you may want to think about longer supplies as much as possible. So this way you can really prepare yourself. So I think people can be, let's say, prepare more and doing some, just to get not just food or water, but also have a plan, communication plan, and have an evacuation plan if that's the case, and share the plan with the loved ones and the kids, and also try to practice a little bit,
Yeah, if you look in anyone's cell phone, I hope that everyone has what they call an ICE number in there.
Yes,
and so
an ICE number.
An ICE number
I have
is
ICE number,
in case of emergency. So if you have an emergency situation, if you unfortunately are in an accident, or if you go to an emergency department, if they're able to open your phone, they can see your in case of emergency numbers. My husband's my ICE, my mother's my ICE, so that if something happens to me, they go right into my cell phone and they can find that. So we just hope to leave you with a couple of practical tips that people can do to heighten their preparedness efforts. So that's really one of the takeaways. Get an ICE number.
But also, by the way, the phone numbers, you can also identify a phone number out of state. Because sometimes if you're caught into some kind of regional disaster, and sometimes you may want to identify a phone that's out of state.
Absolutely.
So this
Got
way, it'd be able to reach them. Especially we have a family members all over the place. They know where to call, where to meet. Those are important stuff.
I'm just curious to know, and I'm going to throw it left field right now. Why does everybody flock or run to the hospital in case of an emergency? You ever notice that? Everybody just runs to the hospital. It's a big surge. Why is that?
Safety.
Yeah,
I think that's
safety's
the
one thing.
beacon.
And
If there's a beacon of safety
Yes.
and a beacon of security and where you can be taken care of, I mean, that's what the hospital should be. That's what Harlem Hospital is. That's what in Kings County Hospital Center is situated right in the center of Brooklyn.
Yeah.
That's what we are. I mean, that's what it should be.
Harlem
I
Center
want
of
people to
Harlem,
come to
yeah.
us.
Yeah.
But to be ready for them is the question, I guess.
If you
at that
remember the brownout or the blackout of, I want to say maybe it was 2002 or 2003.
2000,
Oh, yes, yeah.
2003.
I was actually
I graduated
at Harlem.
that year. I remember that.
I was in the Bronx.
I was
in the
at
Bronx.
Harlem
I had-
Hospital. I was
yeah.
working there,
Okay.
and all the lights went out. And the only light in Harlem was Harlem Hospital Center. I mean, the state office building,
generators.
the Apollo. There was nothing that you could see for miles around except for Harlem. So
Wow.
why would you not want to go to the place where still has electricity, is still well lit, has food, can help you out if you are hurt, and has medical supplies? So for people, I think they look at the hospital as a little bit of a catch-all. So we have to have generator power. We've got to keep our life support and our utilities running. So I know I would run to the hospital if I knew better during a large-scale disaster.
And I guess one of the points that we're making, basically, ladies and gentlemen, is that being aware of these institutions in our community, right? Because you have Harlem Hospital as a place where there are resources where you can go and as you said, there's food available. Ms. Carrington said there's food available. There's services, right? Health services available, but other places, police stations, fire stations,
Medical need shelters.
medical need shelters,
Yeah.
or cooling stations, right? We're in the middle
Yes.
of the
Correct,
summer,
correct.
a heat emergency. When we get those heat waves coming later in July and August, we're going to have cooling shelters where you can go if you don't have air conditioning at home. The heat can be an emergency, can create emergent situations throughout the city. So I guess being aware of these resources in the community as well is a part of emergency preparedness. But we don't think of it that way.
And not even that, I would definitely say is that if you do come to Harlem Hospital, you will not be turned away at all.
True story.
Safe haven.
It is a safe haven. We do want to make sure that we have a manageable amount of supply for the anticipated demand. So that's why we actually are trying to, and I'm so glad you mentioned that, Maurice, diversify what people know to go to or know where to go to during disaster. So the Salvation Army is fantastic. John Jay actually has a special medical needs shelter during times of disaster. So you should use your hospital systems for those in need. But if push comes to shove, we are always there, and you shan't be turned away.
Excellent.
And one thing I just want to go on, because, one time it was a point, this was Hurricane Irene. I think it was the first one before Sandy.
Wasn't you 5
Which
at
was
that
kind
time?
of a false
You
alarm,
like
huh?
you was like 5, right?
No. You're a character. Anyway, that was 2011. And I remember it's about August of that year, August or September. And it was right after that little quake that we had, that little shake up. Everybody was like, "What is that?
Yep.
Right? And then we had the hurricane come. And New Yorkers, as I said before, we weren't prepared for this. This is stuff that happened in California, Florida with the hurricanes. You never seen that stuff here.
Right.
And I remember that Irene was coming. And I was saying to my friends, I was like, yo, I ran to the supermarket and bought a bunch of canned goods. And when I bought them back, my roommates were like, looking at me like, yo, are you insane? Like, what are you're overreacting. At which point I felt a little like embarrassed, like, oh man, but I was doing this to help us out. But when you think about it, you
can't be embarrassed.
You can't be. Yeah. And living in the city, as many resources as we have here, all of the supermarkets and the farmers market at Harlem Hospital Center, when you think about a disaster, a true disaster, similar to Sandy, and the fact that we don't grow anything here, we're not growing apples in New York City, we're not growing, there's no farms with chickens. All of this stuff is being imported and pushed into the city. Once that supply chain stops, that's it. We have a relatively limited amount of resources. And if you don't have your stuff in the house and it's sitting at the supermarket, there's no way to get it. The shelves are cleaned out. So, I mean, we have to be ready in that sense and think of it that way. Absolutely. At that point, I was embarrassed. But thinking about it now, in retrospect, and I guess from my training, even as an emergency medicine resident, you start to think of these things in a different way. And it's really important that we get this out to the community. Ladies and gentlemen, start to get your pens and papers out.
Spam? Would you run
no,
spam
I did
ravioli?
No, I did have raviolis in there, but I had a little. But that's the thing.
Well, what happens if you lost electricity?
Exactly.
And when we had
that's
Sandy, and you were in Chelsea and other parts of the downtown Manhattan area, when you were absolutely flooded out and there was no electricity and no public transportation, you would have not been embarrassed then. You would have been, like the pusher of the canned goods.
With that cart.
True story.
Exactly.
Yeah. True story.
So I think you were just ready.
True story. All right, ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. If you wish to call in with any questions, comments, or concerns about tonight's show, you can call us at 212-650-6903. That's 212-650-6903. We will be right back after this break. Stay with us.
I'll pick you up after school.
You and your family are connected by routine, and you stick to it. But what if a disaster strikes without warning? What if your day's routine is disrupted and you can't reach your family? Have you planned for that? Before a disaster turns your family's world upside down, be ready. Get a kit. Make a plan. Be informed. Learn how at www.ready.gov. Brought to you by the Federal Emergency Management Agency and the Ad Council.
The number one natural disaster in the United States is flooding. The first step in protecting yourself is knowing your risk. FEMA will be updating preliminary flood insurance maps for all 5 boroughs so that all New Yorkers are informed about risk zones and insurance rates. These maps will help homeowners and renters make informed decisions when it comes to insuring their property and their families. The maps will also help communities determine how new developments will be built to ensure they are safe and secure. To learn about whether or not you're facing flood risk and to understand flood insurance requirements, visit www.floodhelpny.org or call FEMA at 1-877-FEMA-MAP. That's 1-877-336-2627.
There's hundreds of fun and simple things you and your family can do to live a healthier lifestyle. Here's 20 of them. Walk to work, walk the dog, have the dog walk you, take a hike, take a bike, skate, dance, hop, jump, do the Humpty Hump, skip seconds, skip dessert, skip to my loo, don't skip breakfast, drink H2O, lower your sodium, raise the roof, shake your booty, stock up on vegetables, and don't forget to eat them. Search We Can online to find more ways you and your family can get healthy together. A message from the Ad Council, HHS, and NIH's We Can program.
WHCR 90.3 FM, New York.
Welcome back to Health in Harlem, ladies and gentlemen. I'm Dr. Maurice Selby.
And this is Sean Shivers, Director of Food and Nutrition at Harlem Hospital Center.
And tonight, ladies and gentlemen, we have from Harlem Hospital Center, Mr. Kevin Shao. He is the Director of Emergency Preparedness at Harlem Hospital Center.
Got that last name right.
Yes, indeed. And Miss Ebony Carrington, also an administrator in emergency preparedness at Harlem Hospital Center, and we are talking about that emergency preparedness.
Correct.
So that we can be ready as a city, as a community, to take care of business and take care of each other, more importantly, if something should go down. And
right before
one of the you have an announcement.
Yes, sir.
Indeed.
Can I say my announcement? Okay. This is just to let everybody know is that this is summertime, so you probably just did some spring cleaning. Harlem Hospital is in need. There are in need for clothes. So if you have any old sweatpants, any old pants, anything, please bring them and donate them to the hospital. You can contact Miss Stephanie Harewood in a volunteer's office, because sometimes the situation is that you have somebody in the emergency room and their clothes may have to be ripped off because of surgery. Sometimes they don't have something to wear when they leave the hospital.
True story.
So we would like for you to please donate your clothes. It might be somebody in the inpatient unit who don't have any clothes when they leave the hospital. So Harlem Hospital is in need of clothes. Anything you have, no underwear, but anything you have, please bring to us. And you can contact, for more information, please contact Ms. Stephanie Harewood. She's the Director of Volunteer Services, and the number 212-939-3516. That's 212-939-3516.
And along those lines, there could be some sort of emergency, city emergency, in which people might not have clothing to go home in. So that's another reason to bring those, donate those items. But getting back to our conversation, we talked about, ladies and gentlemen, in the first segment, what is an emergency? And basically it's something that you're unprepared for, or something that can be potentially life-threatening or could lead to serious harm to one individual or a number of individuals. And you have to be prepared for this unforeseen event. We got to be ready for it, or at least try to be ready for it. And we can have things such as the ICE number that was mentioned, which I don't have in my phone, but I'm going to try to get it
right
in there.
now.
Emergency contacts. In case of emergency, that's what it stands for. But also we have to do things such as having adequate food and water at home, just in case something happens, such as a power outage, which occurred a number of years ago. We all went through that together. So being ready for those type of situations, heat emergencies, which we got the summer coming up, or at least we're in summer, and we can have those heat waves, and which can be very dangerous, especially for elderly individuals, for children. So we got to know where our cooling shelters are. But what are some other things that we can do to be ready for these unforeseen events? Or better yet, what are some of the unforeseen events here in New York City that we need to be concerned about, and how can we prepare for them?
Well, I think we've been exposed to a couple of different incidents. We've seen the gas explosion in East Harlem, and Harlem Hospital Center was actually the receiving entity to one of the most critically injured patients there. It was actually a pediatric patient who came, and he has recovered well under our care, but we never know what's going to happen. He and his father and his family were all about to go to work and school. And then the gas explosion came, and we had to be prepared. So from a hospital perspective, the senior staff, we have small televisions in our office. And so once we know that something's happened in what we call our catchment area, we begin to get ready to receive a large number of patients. It's called being prepared for a mass casualty incident or a mass fatality incident. So we recently have been having, sadly, a rash of shootings, both in the Polo Grounds and in the what are Lincoln houses, and we need to be prepared to receive all of those victims. So even though EMS may not bring all the gunshot victims to us, if you're what we call walking wounded, you're going to go to the closest place. Sure. And so Harlem Hospital has a trauma team. We're level 1 trauma. Mm-hmm. We have surgeons who are always available to care for people who are extremely seriously injured, and our emergency department is ready to receive as many as we are able to hold. And that's what Kevin drills us on all the time is what we call surge capacity. He does drill us, right, Sean?
He really does.
So it's all about surge capacity. So, it could be an earthquake. It could be, well, not an earthquake here. It could be a superstorm. It could be a flood. It could be a power outage. Yes. You could have a train crash, and then how are you going to get all those people from 135th Street and Lenox up the 2 train?
So actually,
they're coming to us.
So actually, Ebony and Kevin, I'm going to throw a scenario at you right now for our community is that, let's just say a bomb goes off right now. Well, let's say a bomb goes off in general at 135th Street. Mm-hmm. How well, or what is the hospital going to do to, or what has the hospital done to prepare for a scenario like that?
Should I go first?
Let me open the incident command center and then you go.
So,
as soon as the hospital leadership is made aware of an incident that's of a catastrophic magnitude, then we would assess the ability for us to be of service. And as soon as we knew that we would likely be a receiving institution, our boss, our senior VP, Ms. Suarez, or myself as her designee, would basically activate an internal or an external disaster. In the case of a bomb threat, it would be an external disaster. We would go into what is called our HIC system, or a hospital incident command structure. We would open our command center. We would establish clear lines of communication. We would create a goal for what we were trying to achieve throughout the course of the disaster. And then the person who really runs the command center and ensures our safety is Kevin. So I'm going to ask you to just take it from there, Kev.
Thank you, Ebony. Just like Ebony said, we would activate our incident command system and absolutely activate our emergency operations plan. One of the plan, which is a mass casualty, this is the one that probably will fit into that plan. So what we need to do is internally, obviously, we have to mobilize our staff as well as the resources to get ready to receive the victims. Mm-hmm. Likely will be inflexible patients. Mm-hmm. Could be up to tens, it could be to hundreds. Mm-hmm. So we have to be ready for it. And also our trauma team would be called in and to be able to operating, let's say, multiple,
as many ORs as possible.
Surgeries as possible. But the most important, we also have a decontamination unit that will be also in operation as well, because sometimes the explosion scenario could be dirty bomb scenario, which is one of a type of a terrorism event. So we have to be ready for that to make sure that all the victims are decontaminated before they enter the hospital.
We might do mass discharge so that we could clear the hospital of patients who are not so sick and don't need to be there, so that we could free up hospital staff and beds and resources.
Yes.
So given the bomb threat and its magnitude, we would really try to empty our system so that we would be able to intake as many people as possible. We call in people from home. We might have to go pick them up. We would prepare to sustain ourselves and our system for several days. So even though we would be treating the people who were right in front of us, we would be thinking about how to keep that going for the next few days until the whole scenario was addressed.
You know what's so funny, and I want to give you all a scenario right now, is that when I first, one thing that really hit me real hard is to take emergency preparedness very seriously is that my first month at Harlem Hospital, Dr. Palmer, Dr. Lawrence, they said they did a walk through the kitchen, and they was like, "Mr. Shivers, do you have any extra refrigerators?" And I'm like, "Extra refrigerators for what?" They said, "In case we need to store there's an emergency and we have to store the dead bodies." I'm like, "Store the dead bodies? Like, what are you talking about?" That right there,
wow. I thought he was going to say
prepared. Like, oh shoot, like you're absolutely right. What if there is some type of something catastrophic? What are we going to do? And that right there made me take it very seriously.
Well, 9/11 was so sad and really so devastating because every hospital was prepared. I know that Bellevue was ready at the time. St. Vincent's was ready. I worked at in Brooklyn at the time, and we were even ready in case we got patients, but
Yes.
no one came. So in that case, we had people outside the ambulance bay. They were lined up with stretchers. People were volunteers that came in. Everyone wanted to help, and no one made it. But what would have happened if more people survived that?
Yes.
How would we have been able to intake them? How quickly would we have been able to address their needs? Where were they going to go after
You're
that?
right.
You can't safely discharge someone to a home that's then been blown up. So, I mean, it was horrible that there were no victims that came, but if they were, that would have put such a stress on the healthcare system, and we just hope to be in a better position and better prepared in 2015 than we were in 01.
Yes. So one thing I want to know, and for the general public really, is how does the average individual gain such foresight, right? And the reason I ask that question is, in healthcare institutions, in government institutions, law enforcement institutions, we have certain insights that the general public just don't have in terms of threats, weather patterns, potential disasters that could arise, and we prepare for those things, we drill for them. But the average individual that doesn't have this insight or information, right, until it's delivered to them, maybe through the media or through government entities, how do you maybe prepare for those or gain insight into those things to be ready? Generally, I'm saying for anything, essentially.
So I feel like we came very well prepared because Kevin always keeps us well prepared. But
Preparedness.
The Office of Emergency Management has tools that are available and resources that you can go to their website and to obtain. And I have right in front of me, it says Ready New York, and it's My Emergency Plan. And if you open it up and you go page by page, you'll see that they help to prompt you to make a plan. They give you templates for things that you should anticipate. Neighborhoods have something called CERT teams, or community emergency response teams. So there are many ways that you can get better prepared. I think the most important part about it is heightening awareness. So I'm so thankful and very grateful for you both to have given us the opportunity to talk to folks about it, so that now they can say, I remember what she said. Let me go on the website. Let me look up emergency preparedness. Let me go to OEM. Let me call my Nana and see if she has a plan, and let's make sure. Yeah, you got to call your Nana. And make sure that she has a plan, or that to go get her list of medications, or you make sure she gets her animals to go with her, because for some people, their pets are their family. I'm very afraid of animals, but for some people, that's their life.
Yes.
And they've got to make sure that they save them during disaster. And so if you have a plan, and I think a little bit later, maybe later in this segment or early in the next, we'll talk about what people can really get prepared for with their go bag. So that's the teaser.
The go bag.
The go
Ladies
bag.
and gentlemen, stay tuned for the go bag.
Please do.
There we go. All right. You're listening to Health in Harlem on WHCR 90.3 FM New York. We will be right back after this break, ladies and gentlemen. You can call us at 212-650-6903 if you have any questions, comments, or concerns about tonight's show. Actually, I'd like to hear your plan for emergencies.
I want to hear it
if
also.
you got one.
Yeah.
I'm challenging you out there in the listening audience
Brother
to share
Smiley,
your
call
plans,
in.
right? I know he has a plan.
Because I know he's listening right now and he has a plan.
Ladies and gentlemen, we will be right back. Once again, 212-650-6903. We will be right back. Stay with us.
WHCR 90.3 FM, New York.
Nurse, set up an IV. And you, her boyfriend. You were the driver?
Yes, doctor, but I didn't mean to hurt her. I only had a few drinks. I was just buzzed.
Just buzzed? Oh, then your girlfriend is fine.
Hey, sweetie. I feel great.
She's really okay?
What, are you kidding? No, not really. Nurse, get me a suture kit. Stat.
Buzzed driving. Maybe we should stop acting like it's no big deal. Buzzed driving is drunk driving. Brought to you by the U.S. Department of Transportation and the Ad Council.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
Tougher than rock. Said I'm black. I'm tougher than rock.
This is the sound of someone correctly installing a car seat. And this is the sound of someone incorrectly installing a car seat. Correctly, incorrectly. Hear the difference? No? That's because installing a car seat incorrectly is terribly easy. So much so, 75% of adults install them wrong. For simple instructions on how to get it right, visit buckleupforlife.org. Ah, perfectly executed. Brought to you by Cohen Children's Medical Center.
WHCR 90.3 FM, New York.
Stay alive. Shattered relationships. No one tries to say misunderstandings.
Welcome back to the one and only Health in Harlem. I'm Maurice Selby.
And this is Sean Shivers.
And tonight, ladies and gentlemen, we have with us from Harlem Hospital, Mr. Kevin Shao. He's the Director of Emergency Preparedness at Harlem Hospital Center. And we also have Miss Ebony Carrington. She is also an administrator. Can you, the official title?
I am the Chief Operating Officer.
Chief Operating
She's
Officer.
over all of us.
That's what I'm talking about. I didn't know what I'm bugging out. I didn't know what COO stood for.
It's all good.
Chief Operating Officer of
It's
Emergency
all good,
Preparedness at Harlem Hospital Center. And that's what we're talking about tonight, ladies and gentlemen, emergency preparedness. But before we get back to our conversation, Sean has another announcement.
Real quick, the Department of Food and Nutrition Services and also Harlem Hospital wants to make sure that everybody is safe this holiday, the 4th of July. So if you're grilling and cooking on the beach, on the corner of 135th, 125th, 148th, or in your backyard, please make sure your food is safe, because the CDC states that 1 out of every 4 people develop some type of food poisoning, salmonella, listeria. So
E. coli.
Two things I just want you to make sure. Please make sure that your cold food is on ice and not just sitting in the sun. Make sure that it's below 34 degrees. Go right to the store, buy yourself a thermometer. Also, make sure that your hot food is above 140 degrees. And if you're grilling your meats, make sure the internal temperature is 165. These little tips will save your life. So please make sure you do that for me. That's
yes,
it.
indeed. For real, for real.
Yep.
And also, I would say, let's be responsible with our beverages and just in terms of our behaviors, dealing with fireworks. If you are going to do that, you know it's against the law in New York City. I just want to make that clear. Against the law in New York City, especially not even sparklers. That was on the cover of the papers today. Not even sparklers. But if you're going to use that stuff, be safe with it. And especially with alcohol, do not drink and drive. That's one thing we definitely don't want people doing.
You have all these tips. Drink and drive now.
No, for real, man.
It's all good. It's all good.
But
like one thing I want to say real quick is that it's a little story is that sometimes when I be going to some of the people's house parties, people cook out, they be like, would you like a plate? I was like, no. They was like, why? I said, I've been sitting out. And it's so funny, a lot of people, honestly, do not even know. So I always try to preach that. Be safe.
For real. Preparedness.
Yes.
And back to our conversation.
Yes.
So we were talking about the go bag right before we went to break. And this is something that I guess in a general sense we can all do for ourselves, for our families, is to have something prepared for any emergency. So what is this go bag? What should it contain? And how can we use it?
Okay, I'm going to speak slowly because I want people to create their go bag. I want them to have one for each member of their family, if possible. You got to make it sure.
I know.
For each member of their family, and they need to check in with it every month or so, or every 2 months, to make sure that the contents are intact. So every household should have a go bag. What's included in your go bag is 1 gallon of water per person per day. You need to make sure that you stay hydrated. You may not be able to get back to your home, and there may not be any stores available. You need 3 days of non-perishable food that has some kind of value to you, so not Doritos and Cheetos. We need first aid and medication for 3 to 7 days. So if you do have a chronic condition and you have to take your medication, you should at least have a 7 days worth of supply. Flashlight and batteries, and the batteries do need to be changed frequently. So that's what you would put in your checklist for your go bag. Some clothing and bedding. So you should have maybe a sleeping bag, at least a pillow, some tools, a scissor, a screwdriver, and special supplies for your children, for your elderly relatives, for those who are physically challenged, and lastly, for your pets. And then you should bring some money, some cash on hand, because we may not be able to swipe, and we always need some currency. And for certain folks, don't forget your glasses. So that is what your go bag should consist of. It should be somewhere that if you have to get out of your house, you can grab and go. And for those people who are geeks like me, if you watch Criminal Minds, when they say wheels up in 30 minutes, that means go get your go bag. And so you should be able to go wherever you need to go in 30 minutes or less, much less if there's a fire. So get your go bag.
Got you. Makes sense. Kevin, I want to ask you a question as far as surrounding businesses, bodegas, businesses within a community. What can they do on a smaller scale to be prepared for an emergency?
If you have a business, I guess you have to think a little bit more than just the person or families. And obviously, you have to have a contingency plan for your business, in case something's not working or you lost electricity, or let's say your neighborhood will be affected by whatever the event may be. So you got to have a contingency plan for your business. I think the first thing you need to do is think about insurance. If any insurance you can purchase, purchase some insurance. Absolutely. And you should also have a communication plan to whoever you need to communicate to. Make sure that you have those people figured it out in your plan. So this way, in case you have some difficulties, whatever, you'll be able to communicate to get the help you need. And also, you got to have your staffing plan. If you have an employee, let's say a large group of employees, so you got to have your staffing plan. Make sure that you be able to communicate with them and let them know that what is your contingency plan if in case there's an emergency. And also plan for your supplies. For the most business, you may have some kind of supplies that you rely upon to running your business. So you got to make sure you have a reliable supply. And if you have to store some and you, let's say on site, you may have to think about that one as well. So finally, think about the utility that will affect you. Sometimes during the disaster, you're going to have some kind of interruption with let's say electricity or gas line, whatever So you got to figure out how you're going to have some kind of backup system for that. So this way you can minimize your risk in terms of the loss of your business, and also feel confident that you're actually prepared for those type of events.
You make a good point, because we're going to go back to the first segment. Ebony, you had mentioned about during the blackout, the only beacon on the only light was at Harlem Hospital. And I think that a lot of small businesses do not invest in generators.
Absolutely.
If they invested in generators, then, so that's a very good comment right there.
Well, Kevin was mentioning a survey that was conducted by the United States Census Bureau, and almost 87 or 88% of businesses do not have a generator present. So you basically just X yourself out of operation and of being any location for safekeeping for yourself or for the community if you don't have a generator. So what's very important, and I think it is good to have generators at churches. It's good to have generators in local businesses, because if you're not able to go back to your home, then where are you going to go? In Harlem, you're going to go to a church. You're going to go to big churches, and if they too have no electricity, then you'll actually, I think, create more of a safety condition, because too many people roaming the streets with nowhere to go and no food and no restroom is a riot situation. So the better that we can become what Kevin always calls a resilient community, the better we can work together and cohesively to be prepared as a unit, the safer we will be. So if everyone got a generator, then you wouldn't have to flock to one particular place or the other, and we could diversify our options a little bit.
I'm curious to know, see, you just opened up my mind again for another question, going back as far as the hospital in general. Because you had mentioned about 3 days supply at the hospital. Let's just say that there is a major disaster and the real bomb drops, whatever, and let's just say a week or two goes by. How prepared is the hospital? Because you mentioned about riots. How prepared is the hospital in a case like that when you can't get people to come in, and the situation happened with Hurricane Katrina? How prepared?
Or Hurricane Sandy here in the city, the hospitals.
Right.
NYU and Bellevue were down for a long time.
So
Coney Island Hospital
so how
down.
prepared is the hospital with a situation like that?
Currently, hospital, we have a plan that we will plan for at least a 4-day, 96 hours in terms of sustain our operation to be able to self-sustain, including the medical supplies and food, water, and so forth, so on. And also, don't forget, we live in a community and within the state, within the federal government. So, in the sense that we have a large plan to be able to respond to regional disaster if that's the case. So the reason we would be able to, let's say, self-sustain for 4 days and 96 hours is because it will take probably 3 to 4 days before you can see the federal government would be able to step in to be able to provide the necessary resources to continue your operation. If if you have to try to sustain the operation during the major disasters like Katrina's.
What you just described is what we call push to failure. So after 96 hours, many of your supplies will begin to deplete. People will start to feel a panic, and that's when you really need for the Office of Emergency Management, federal entities, and others to come in and to be able to supplement your aid. So, you're doing well for 3 to 4 days, but after that, that's when it starts to become a little bit more of a panic scenario, and we're all not as equipped as we could be to get past that. So 4 days and that's it.
Gotcha. And one thing I want to mention is that in the Department of Food and Nutrition, because food and water is one of those essentials, is that after 4 days, and if we have contracts set up with local vendors that after 4 days, that they are to immediately come and replenish our supply in an event that a disaster is prolonged.
Yes.
And just before we go to break, I think, this also, in general, preparedness, right, with supplies. That's what we've been talking about a lot, having ample supplies and the shelter and all of these things in place, but just having a mental preparedness for, we don't know sometimes how long an emergency situation may last. So being mentally prepared to say, look, I got my go bag. I know I got 4 gallons of water ready, right? So I can last 4 days, but I might have to stretch that out longer. So I'm not going to guzzle the gallon in the first day. I'm going to take it easy and sort of ration these supplies because we don't know, especially with, we talk about going back to Sandy, man. I didn't think it would be that disastrous, especially for those areas that were devastated in Lower Manhattan and out in Rockaway and southern Brooklyn. But, it turned out to be a lot worse than we anticipated. And thank God we were able to sort of divvy up supplies, and other areas weren't hit as bad. But the disaster scenario that you just outlined, more severe, lasting longer than anticipated, we have to be ready and sort of not use up all of our supplies in that first few days. Ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We will be right back after this break. This is your last chance to call in at 212-650-6903. That's 212-650-6903. We will be right back. Stay with us.
WHCR 90.3 FM New York.
Hey, WHCR 90.3 FM New York listeners. We know you like to be informed, inspired, and entertained. That's why every Tuesday, Wednesday, and Thursday at 6 p.m., I, Joshua Bolden, will bring you your latest news and updates. From national headlines, pop culture, news around the world, and issues that affect you and I here at home. It's WHCR News with Joshua Bolden. Tuesdays through Thursdays at 6 p.m. You don't want to miss it.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM, Peace.
Tougher than rock. Said I'm black. I'm tougher than rock.
This is the sound of salmonella gyrating on your undercooked chicken. And it looks like Mom might be taking it out a little early. Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. So use a thermometer to cook each type of meat to the right temperature. Keep your family safe at foodsafety.gov. Brought to you by the USDA, HHS, and the Ad Council.
WHCR 90.3 FM, New York.
Deep down inside. Healing. We got to have healing. Swallow your pride.
Welcome back to Health in Harlem, ladies and gentlemen. This is Maurice Selby.
And this is Sean Shivers.
And you're listening to Health in Harlem on WHCR 90.3 FM New York. Tonight we have with us from Harlem Hospital, Ms. Ebony Carrington. She is the COO, the Chief Operating Officer of Emergency Preparedness at Harlem Hospital Center. And we have Mr. Kevin Shao, the Director of Emergency Preparedness at Harlem Hospital Center, and that's what we're talking about tonight. Before we get back to our conversation, I got one more announcement to make, and this is about the weekly Harlem Hospital Center Farmers Market. It has been going down since May 8th and will last until November. As usual, every Friday from 8 a.m. to 7 p.m., the farmers market is open. That's a pretty long time. We're talking 11 hours, ladies and gentlemen, for you to go out there and get your fresh produce from local farmers at a very reasonable price. The Harlem Hospital Center Farmers Market is located between 135th and 137th Streets, right on Lenox Avenue. They accept everything from senior FMNP coupons. They accept WIC. They accept health bucks. Yeah, man. Yeah, they offer everything.
What about cash?
They take cash too. You got credit or debit cards, they take that. So go check them out. This is sponsored by Harvest Home, and we want you to enjoy this fresh produce at a very reasonable price. Definitely the healthier option to a lot of what we see in this community and other parts of New York City. So definitely take advantage. Why not? And also, you can go and learn about some emergency preparedness at at Harlem Hospital. Get your supplies there too. Just make a one-stop shop. For real, man.
Such a character.
Alrighty. So, getting back to our conversation, ladies and gentlemen, we are talking about emergency preparedness tonight. One thing that I want to know, right? I feel like sometimes we can get into sort of a boy who cried wolf situation, right? We're constantly at a heightened sense of alertness, just looking at the media, all of these mass shootings, right? Terrorist attacks happening globally, and they seem to be an increased frequency. We have natural disasters, we have earthquakes. I think most recently in Indonesia, we had a pretty catastrophic earthquake. We had our own issues here with natural disasters and mass casualty incidents in New York City. So with this constant state of heightened alertness and also the drilling on top of that, right, we have the constant drills, disaster drills going on throughout New York City. When is it possible, or how can we avoid this sort of boy who cried wolf situation where something's going down and we say, look, this is an emergency? I remember the alarm bells going off for fire drills, and it came to a point where you're just like in the institution, like, oh, class will keep going. It's not real.
Not taking it serious.
Yes. So how do we get past that psychologically? What can we do to avoid that? I know it's a challenge. That's a challenge. I'm sorry.
I think that's a very good question, actually. And people do get fatigued about, when you constantly talk about the subject. But it is important to talk about. I think right now, what we recommend people to do, actually, in the hospital when we do the training, for the staff, is basically we encourage them to take an all-hazard approach.
Right.
All-hazard approach means that it doesn't matter what kind of hazard or threat that you face on a daily basis. Let's say you live in a city, obviously, the things that you see every day, let's say building collapse, even the disease outbreak, especially in the dense population, you're going to have that kind of, let's say, risk. So your preparedness really depend on where you live, your community, in that sense. So you have to know your risk. On top of that, I think what we just said, you take the all hazard approach.
Right.
It really doesn't matter what kind of situation they're gonna come to you. Go back to the basics. Just as Ebony mentioned before, you make your plan, right? You get informed, get involved in the community activities, know the resources in the community, and build a go kit. That's very important because if you ever in a time that you need to go, you gotta go. Guess what? You have a kit that's ready. You can just grab it and then just run. So that can probably save your life, in time of crisis.
The thing about all of us is I think we're highly sensitized to drilling. So we all work in a healthcare environment.
Yes.
So we do have fire drills. We are hearing about in-service where you need to be prepared. But for the average New Yorker, I think that they're very underprepared, and they not to be too street, but they play disasters very sweet, and that's
You're right.
and that's
You're right.
why we are usually so underprepared as a community, because people don't ever think it could happen to them. No one felt that a building could collapse in their neighborhood. No one felt that they would be sitting in Bible study and have a mass fatality incident. So if you are on more heightened awareness, if you are looking around for your environment, if you almost live with safety and precaution at the forefront of your thinking, then it won't be the boy who cried wolf, because you yourself will just feel like, I'm more prepared. And so if something happens, I won't be so jarred by it. So I really would encourage people not to be underwhelmed by disaster, but to be more prepared for it. And then they would be able to handle and manage it much better.
Actually, and I want to throw this out here. I'm going to throw in the left field again because something that you said triggered a thought, is that in the news they always talk about active shooters. They're always talking about people getting postal, coming into hospitals, state facilities, and just going buck wild. How prepared is the hospital in a situation like that? Because you got patients in there, they have nowhere to go, they can't run. So how prepared is the hospital as far as active shooters?
I would say that the hospital is very prepared for two reasons. Hospital police, as you know, is one of the departments that works on our team with us. So as an operations team, we all work with many disciplines. And what you can never do is get proactively prepared for an active shooter, but you can know how to respond. And so our hospital police department does an exemplary job of helping people understand what to do when the active shooter presents. Staying quiet, boarding yourself in, putting multiple cabinetry with a lot of pieces of paper in between it. They've even helped us understand that the more paper you have in between yourself and the bullet, it slows it down by, a certain number of miles per hour based on the amount of paper in between you. And they are very, very well liaised with NYPD. So the hospital is in a great position to respond to an active shooter. I think the only thing that we can do as a community to be prepared for an active shooter is to keep our eyes open. To make sure that you notice when people become disheartened, to make sure that you care about your community and you see when someone's, a little bit down, or they're withdrawn, or they disappear from work for long periods of time, or when someone just has that, people always say, he looked like he was about to do something. And so really making sure that you have a plan. And at Harlem, our plan is run, hide, and fight. So you run away as far as you can.
I remember that.
You hide, and then if they approach you, then you fight. So run, hide, and fight is our plan. So I think we're well prepared. We have a little brochure, and even the people who work and aren't expected to fight know what needs to happen. They turn their cell phones off. So for all of you in the audience, turn your cell phone off. Don't put it on vibrate.
Don't be trying to call out to the news channel.
Exactly.
Oh, I'm in here and this is going.
Yeah, they can still hear vibrate. So.
And it's so funny. I want to give a quick shout out. I know he's not listening to the Detective Marty. He's a character, but he actually came into my department and showed us how to fight. He was like, "If you have to fight, this is what you do."
Yes.
It was hilarious at first, but everybody in the department got right on to what he was saying. Because sometimes you have to do that.
And I think to take it to the next level, right? Not only just to save yourself, but in these type of situations, basic first aid skills can be so valuable. You can literally save a life with just simple knowledge. And we're talking about putting pressure on bleed. If somebody got shot or somebody's bleeding out from somewhere from an injury in some sort of disaster scenario, putting pressure,
Dr. Taylor
elevating
broke that down.
the extremities.
It was crazy how she broke that
All of these
down.
things can definitely save a life. Making tourniquets. This is something that went out of fashion for a while, but tying off a bleeding extremity can actually save a person's life. And you can do a lot of good for somebody. Knowing CPR, basic life-saving skills, before somebody gets to a hospital where they can receive definitive care, can save a life. So just getting those skills, which are readily available and reasonably priced, or even free in a lot of instances, can go a long way. And I like to say, because we get a bad rep as New Yorkers, everybody thinks we're like, very standoffish and don't give a damn about anybody. But I beg to
Feels like
differ.
that sometimes.
And I've seen people in trouble where New Yorkers stepped in and helped out the next individual. So I know we have 9 million people. At least half of them are very friendly and outgoing and willing to do this. So let's get to it. Let's get to work.
Excellent conversation.
As we begin to wrap
this.
up, what would you say is the most important message that our listening audience should take home from tonight's show? From both of you, yes.
Okay, I start first. I think the tip is basically really get prepared. To make a plan, get involved, get online to check some information, to learn something about the emergency preparedness. I think the most important one is that you really have to get a community ready, and because it does take a community to respond to large scale disasters. And so I was just hoping that today's show will give you some insights why you have to get prepared.
I would just say take it seriously. If there's nothing that you take away from this conversation or from our interaction with you all today, it is that emergencies are real, that there is a way to be better prepared for them, that there are strategies and behaviors that you can put in place to make sure that your family is safer. And what we really didn't touch on, but what I think is a good takeaway, is practice with your children. If your kids are in the house and they need to know what rooms to go to, how to close doors, how to stay safe if they hear an intruder come in, because let's not forget, intrusion and acts of violence are also emergencies. They're disasters and catastrophic to a family. So I would just say, please take it seriously. Make sure you're having the conversation and get prepared.
That's
excellent.
what's up.
Excellent.
Oh my goodness,
This was a great
this
show.
is an amazing show.
Very good
and I think we had a lot of fun here tonight, and I think I implore our listening audience to also have fun with this, even though we're talking about disaster scenarios. Preparing for this, gathering with your family to go through these exercises and sort of drill and talk about these issues can be actually fun. It can be, you can engage each other and make sure that you engage each other, have a good time, but also that you're ready to take care of one another.
And we definitely want you to take 2 minutes of your time to come outside. I think it's August 15th, and give us a summary of this entire show.
Up. Harlem
Great
Week.
on Harlem Week, Harlem Day.
Okay.
From the hospital.
We would love to. Thank you, guys.
Thank you very much, Ms. Carrington. Thank you very much, Mr. Shaw.
Thank
you.
Also, I want to thank my man, Sean Shivers.
Always, my brother, and thank you. And everybody, please make sure you tune in next week, because our topic of conversation is what we always talk about: informed consent, patient's right, HIPAA. What you say to somebody at the hospital is your business and should not be shared. And we're going to have Yvonne Reynolds, Levy Delgado, and Robert Hinton, my colleagues, come on to the show and talk about that subject. So please tune in next week.
It's going to be a dope show.
It is.
We also want to thank Miss Valerie Wright and Nancy
That's my
Simmons.
girl.
They are the producers of this program in the Department of Community Outreach at Harlem Hospital Center. We also want to thank you, the listening audience, for tuning in, because we couldn't have a show without a gracious, wonderful listening audience. This show is dedicated to the memory of Miss Gloria Thomas. Harlem, take care of yourself.
WHCR 90.3 FM, New York.
Wisdom.
righteous. Can't you see the sign of the time we're living in? Got to use it every day. It's what we need today. Oh, we got to use it every day. It's what we need today. Wisdom and knowledge will guide you through. Don't you be the devil tool. No, you can't guide a people without a vision. You shall surely go astray. The Bible can teach you wisdom, whether you wise or you dumb. An elder can teach you wisdom, whether you're old or you're young. Oh, wisdom, oh, wisdom, oh, wisdom. Only a fool trust in his own eyes and disregard correction. You got to be humble, free from anger, and your days shall be low. You gotta use every day. It's what we need today. You gotta use it, every day. It's what we need today. Oh, wisdom. All right now. Oh, wisdom. Hey.
Fellow citizens of Africa, I greet you in the name of the Universal Negro Improvement Association.